I love New York City. That's why I work in New York City. New York City is a wonderful place. The theaters, the museums, the people, restaurants, born and raised. I was born in the Bronx, and I went to school here. I went to NYU, and I did my surgical training at Bellevue Hospital, New York City, and New York University Hospital. Completely New York City boy. That's all I know is New York City. I'm Dr. Jeffrey Burkes, and I'm a New York City oral surgeon, and I love it. Oh, Mr. Foreman, how are you?
Good, how are you?
Welcome, good to see you. I became an oral surgeon by first being introduced to oral surgery during my time at New York University College of Dentistry. As I was training to become a dentist, part of our program was to rotate through and learn about oral surgery. And when I rotated through oral surgery, I was just very fascinated and excited about that field and what they could do. As an oral surgeon, you get to see many new patients every day. I like people, and the more people I meet, the more I like doing this. So every day it's a new day, it's new histories and people I'm meeting, which fascinates me, particularly working in New York City, where you get such a varied strata of people. How you feeling otherwise, okay?
Yeah, yeah, but I can move it with my fingers.
Yeah.
That shouldn't be, right?
Well, something's loose. Correct. The screw gets loose too.
Screws in my head are loose.
Yeah, you get a loose screw in your head. The thing I love most about being an oral surgeon is the people. The surgeries are interesting, but it's pretty routine at this point. But what's not routine is the different patients and people and their personalities and what they bring to this office. And I love it all. I love dealing with all types of patients and different patients. My approach to treatment patients is how you approach people. You have to hear about who they are and what they're about and what they need. In oral surgery, a patient comes in many times in acute pain with a swelling and some real problems, and they leave relieved of the pain, and the next day when we call them to find out how they're doing, they're very happy, and that the problem that they had is now gone. And I like that. I like sort of an immediate gratification.
I think the Nova, so what is, so
Yeah.
we know you put something in there, but this is proof.
This is it. Yeah, this is the proof. It looks perfect. Would you like some Tylenol now, take before you leave?
No, I don't feel,
Sure.
I'm not sure I'm gonna have a need to do it.
Well, in addition to being an oral surgeon, I'm also a forensic dentist, and that also began during my training as a dentist at NYU College of Dentistry. Had I had the free will really to do what I wanted, I probably would have joined the New York City Police Department rather than go into dentistry at the time. Now, as an oral surgeon, I'm able to work with the police and to do the work that they're doing in the detective work of solving crimes and getting people identified that normally would not have been identified. Whenever a forensic dentist is needed in an evaluation of a bite mark, an evaluation of identification of a victim, or in a mass disaster. And New York City has seen its share of mass disasters in the years that I've been a forensic dentist and the chief forensic dentist, but obviously 9/11 was the most severe and the greatest tragedy that ever struck the city. And being a person that loves the city, I took that as a personal attack. It was very rewarding to be able to work 9/11, being in charge of all the dental identifications that were done at the time, being able to identify these remains. And I don't believe in real closure. We speak of closure, it's always talked about in the news, there's closure now. The only way I would see closure if I could make that person come back to life. You heal very well, it looks beautiful. And whenever you're ready for the bottom one,
Yes.
do that.
Well, I want to finish the top
first?
first,
Fine.
and then I'll go with the bottom part
Okay.
later after we're done with the first.
There is no typical day in my office. Every day is completely different for a variety of reasons. We do a multiple type of procedures here, from implants to extractions to apicoectomies to biopsies. And although you may have a schedule the night before and even 10 minutes before you start your day, that schedule has a tendency to change.
And the last patient canceled, he's stuck in Boston, his flight was canceled. So he rescheduled.
It's not just one type of person or one type of patient that you see. And that's also why I like the city, because you get that diversity. Okay. You're looking good. Excellent. If you like what you do, you never work a day in your life. I haven't told my wife this, but I haven't worked a day in my life. I just don't want her to find out about it. I tell her how hard it is at work, but I love coming to work, and I love working on my patients. It's the same way that professional ball players. We pay them, $5 million, $6 million, but they probably would do it if we paid them $100 a game. And if we didn't pay them at all, they love it. They love the game. They love doing it. I can't see myself retiring. I can see myself maybe cutting back days, maybe giving some more days off, but I work 5 days a week, and I enjoy it. I enjoy every day. It'd be nice if everybody could enjoy their work like this, because it'd be a lot happier place. There is nothing else in the world that I would rather do than be an oral surgeon, and there is no place in the world that I would rather be an oral surgeon than in New York City.